Alright, so let us begin with a very small remedy today, which is in relation with the previous remedies that we are discussing. We are right now discussing the gastric remedies and the remedies which work on the rectal region and whatever their features are. Mainly the remedies that are Aeschylus, Elos, Podophyllum, Crotontic, and a remedy in the same line of thought which we should know is Ratanhia. So it's a very small remedy from Allen's keynotes. So we'll quickly go through it. But it has three main spheres of action. One of the areas is teeth. So for teeth, we see that there is terrible toothache during early months of pregnancy. Tooth feels elongated, aggravated line, compelling to rise and walk about. Similar presentation you will also see in magnesium group, magca, magmu, you will see in many other remedies, but the top remedies that come through are the magnesiums and the Ratanhia and also the carbon group at times. In the pregnancy, the state is or hyper stimulated. It is the best period to begin or to give the constitutional medicine to all the females. If you have read Hahnemann's chronic disease, you will see that pregnancy is a state which is, which in which we should give constitutional medicine so that the state of the patient is balanced. There are not too many exacerbations, acute exacerbations, and there is a healthy child which is delivered. This is mentioned in Hahnemann's chronic disease. So, what we have in Ratanhia is terrible toothache during pregnancy. Many ladies will have toothache, some will have gastric troubles. If they have these issues of toothache, think of Ratanhia when the patient wants to walk about and feel better. Gastrointestinal system, which is the main seat of action for Ratanhia. Constipation, there is hard stool with great straining. So you'll have someone who is presenting like nux vomica, but if you have many features where the patient is aggravated by least touch, in the repertory there is a rubric, pain in the rectal region aggravated by touch. There are only two remedies, hepar and and Ratanhia. So if you see that there is presence of hepar, which is highly sensitive remedy, there is another remedy which is mentioned, and that is Ratanhia. So you can understand by the presence of the remedies in the rubrics about how you should study the different rubrics. And when in such a rubric, I think it is in the reliable repertory which is available with the Synergy software. If you see that there is this presence of uh, pain in the rectal region aggravated by least touch, the patient will not be able to sit, he will not be able to wear the clothes which are always touching the rectal region and causing him pain. Hepar and Ratanhia are top remedies mentioned, and if you have Ratanhia to be given, you will see that the patient has constipation or he has to strain a lot. There is protrusion of hemorrhoids followed by long lasting aching pains and burning in the anus. So you'll have a feature which is more similar to uh, presentation of sulfur. There is burning, there is portal congestion, there is rectal congestion, and there is inability to pass the stools clearly. The bowels are inactive and pains as if splinters of glass. This is one of the most commonly encountered. We saw in Dioscorea yesterday that there is twisting pain which most of the patients will tell you. Similarly in Ratanhia, most of the patients will tell you that there are sticks or pains as if pins are causing me trouble over that in that region. In those cases you can think of prescribing Ratanhia. Other remedy given is Thuja. Excruciating pains after stool. So you have many patients who will tell you that once I pass the stool in the morning, maybe at 8 o'clock, 9 o'clock, whatever time, the pain continues for 6 hours, 8 hours, and it doesn't seem to abate by anything that I do. Even 6 bar doesn't help. In those cases, you can think of Ratanhia. but the feature is slightly different from that of nitric acid. In nitric acid there will be constant pain as if splinters, but here the splinter like pain is accompanied by burning, especially even if the stool is soft or hard, whatever type of stool will be, there will be burning and sticking pains in the anal region. In cases of fissures of anus, you should think of Ratanhia as one of the remedies along with the normal treatment that you are giving to the patient. Why this? Because there are some remedies which work on the organs. If you don't give those remedies which work on the organs and you are totally depending on your constitutional medicine, that effect may take time to come, or the patient's vitality is not strong enough that the organ will heal itself. So sometimes along with the constitutional treatment in the background, you should give these smaller remedies in extremely low potency, 6, 30 or 200, maybe every 3 days one dose or every once a week one dose. That is how our many of our stalwarts practiced. Since we have shifted to classical methods, we don't know how they practiced. If we go back to read their cases, we will get to know how easily they cured pathological cases, and this is the way forward for every homeopath. So you have fissures of anus, great sensitiveness of rectum, and last we come to the final point, which is female reproductive system, fissures of nipples in nursing women. Graphitis and sepia are strongly mentioned. Another remedy which I suggest is also phytolacca, especially if there are lot of fissure related issues in the nipple area. You can compare Ratanhia with remedies, and from this comparison of the names of the remedies, you can understand how beautifully it acts on the different areas of the body with those sensations. For example, the first medicine mentioned is cantharis, next is carbolic acid, third is iris versicolor, fourth is sulfur, and fifth is thuja. So wherever you see the features of these remedies present in any sphere of the body, and you are thinking that it may be looking like sulfur or it may be looking like cantharis, a lot of burning, stinging, it is also like thuja. The patient appears like thuja, but you want to give thuja as a deeper acting remedy, but give Ratanhia as a small acting remedy, and that is going to relieve the complaints whichever are present in the gastrointestinal system or the female reproductive system, which we discussed, especially the mammary related issues. So that brings us to the end of today's session, a very small remedy, and we'll continue with the Allen's keynote study streak further, maybe from next week onwards, because today being Tuesday, okay, we'll have a session tomorrow as well. So we'll take up some new group of remedies and take this session forward. So thank you for joining, and those who are learning the Allen's keynotes along with me, if you are getting the benefit of it, please drop in the comments so that I know that you are studying along and it is helping you all. Thank you.